Hi, welcome to Veterinary Clinical Anatomy channel. Today we are going to talk about the feline aortic thromboembolism and its clinical anatomy. Aortic thromboembolism, also known as the saddle thrombosis, is a common complication of the feline heart disease. We call it saddle thrombosis because sometimes the blood clot lodged at the distal end of the aorta is similar to a saddle. In most cases, as a result of a heart disease, like an enlarged left atrium, a blood clot forms in the heart and moves by the aorta to where this artery bifurcates to the right and left external iliac arteries, and then this clot traps there. The external iliac artery is the major branch of the aorta which supplies the blood flow to the hind limbs. So, as a result, ischemia of the hind limbs begins. This is a very bad and painful condition for the cats. They vocalize and are agitated and show symptoms of the hind limb paralysis. If you look at the foot pads, they'll be cyanotic, and if you palpate the foots, they could be cold and numb. Also, the hind limbs are pulseless. This is the radiograph of an 8-year-old female cat that was presented for sudden hind limbs paralysis. As you can see here, we measured the vertebral heart size of this cat. VHS is 10.5. It means that general size of the heart has increased significantly. Size of the left atrium and left auricle is much bigger than normal. In the Doppler ultrasonography of the distal aorta, occlusion of this artery with an embolic thrombus was confirmed. Then appropriate treatment was administered, but finally after 4 days at the owner's request due to the severe pain the cat was experiencing, euthanasia was performed. So we did necropsy on this cat. In this image you are looking to the thoracic cavity of the cat from the left side, and you see main anatomical structures including right ventricle, left auricle, right auricle, cranial vena cava, cranial mediastinum, and cranial lobe of the right lung. As you can see, the most prominent finding in this image is a huge left auricle. Then we open the left atrium from the dorsal, so we are looking from dorsal view and you see a big enlarged left atrium. The yellow arrow indicates the mitral valve and the green arrow indicates the left auricle that is enlarged. We open the abdominal cavity to find the thrombus. This is the descending aorta, and under the aorta we will find the caudal vena cava. This little branch is the caudal mesenteric artery which supplies blood flow to the descending colon and proximal rectum. This is left external iliac artery and this is right external iliac artery, and here we see the left internal iliac artery. As you can see here at the distal end of the aorta, the blood clot is fairly visible. Then we opened the aorta and you see thrombus clearly now in the distal end of the aorta, which confirms aortic thromboembolism. Thanks for watching this video. If you want to learn about another topic in veterinary clinical anatomy, write in the comments.